Today I'll be talking about what nurses do. So there's a lot of stereotypes around what nurses do or what nurses can do, and I'm going to be using simple terms in my video because I'm trying to, educate the public. So I want even the most, I don't know. I just want everybody to understand what I'm saying. So I'm going to be using simple terms. So what do nurses do? What can nurses do? I mean, there are a lot of stereotypes about what nurses are. Do you think a nurse is someone who just gives injections? You're sleeping. Or you think a nurse is someone who is lower than a doctor or is a doctor's assistant, or who takes it out from a doctor? Well, you're quite wrong. So today I'm here to teach you what a nurse is and what a nurse do. First, I want to say that nursing is a profession, is independent. Like how to put it, nursing is a whole profession on its own. It's a whole scope of what to do and how to do it. And nurses work together with other healthcare professionals to deliver care. In the hospital, there are various healthcare professionals, and we work together. We do different things to deliver care to the patients. Now, nobody is superior or inferior to anyone. However, within each profession, there are, there are levels. Like now, as a nurse, I have orgas in nursing, like within my profession, that I'm accountable to. There are people above me and people below me too. So yeah, that's for that. I want to clear that. So, but each profession is autonomous, but we all work together to achieve a goal, and that is to give the best to our patients and ensure that they go back to their health. So ensure that our patients are fine and that they're treated. Nurses are clinical decision makers. So while a doctor diagnoses a patient problem like a medical condition, the nurses will have nursing diagnosis that is more about the nursing problem. So we manage a patient's entire environment, we calculate drug dosages. Nursing have a lot of specialties, but then we also have a general nursing. One of the things a nurse does, which is very popular, is that a nurse administer medications, we know, but a nurse also manage the entire patient's environment. We calculate drug dosages, we monitor hemodynamics, we manage, patients that are on ventilators, patients that are, on life support. We provide psychological and emotional support to our patients, taking care of patients from bathing the patient. And when I say these things, there are scientific procedures to do all these things. So we bathe the patients, we take care of the patients, we administer their medications, we assess the patients, we see what problems they have, we see if they're at risk of infection, if they're at risk of falling, and we ensure that there are no complications to their situation. We monitor their recovery, we see if they're improving, if they're not improving, we check their vitals. I mean, we just do everything to ensure the patient and the patient's environment is as good as it can be. And if possible, we try and make the hospital a place that is very close to home for the patient too. We try and make it very comfortable. We check the medication orders to ensure they are correct. We check the medications to ensure they are not expired, to ensure they are given to the right person, to the right patient, and all of that. We coordinate the care team, and basically we're the brains of the bedside because we literally stay there all day. There are different specialties of nursing that are clinical, but then there's also the part of nursing that is not clinical. So nursing is really broad. And so when I say what do nurses do, nurses are also involved in documentation, in administrative work. I mean, when they're coordinating the administrative part of an healthcare facility or an healthcare company. We also have nursing informatics. Then we have telenursing, that's providing nursing services online. One different aspects of nursing. Nursing is the protection, promotion, and optimization of health and abilities. It involves the promotion and optimization of health activities, and we use the nursing process to make clinical decisions. That is, I mean, I can't be giving you free lessons. I have to read and pay in school to get all these lessons. But we have something we call the nursing process, which we use in managing our patients. That includes assessment, diagnosis, intervention, and all sorts of things. I'm going to use an analogy to explain what nursing is. Imagine you're an house. You as a human being, you're an house, and then one day the pipe goes wrong, the pipe is broken, that is you're sick, or maybe the lights goes off, that is you are hot. Now imagine this: a doctor is the person who looks at the map of the house to see where something is wrong and what is wrong, but the nurse is the person who lives in the house with you to monitor you, to ensure that the pipe is repaired properly, to ensure that the pipe does not get broken again, to ensure that you are okay even with the pipe broken and even with the light off. So the nurse is the person that stays in the house with you to make sure you're safe. So they know exactly when you need body fuel, right? That is medicine. That is, they know when you need body fuel, they know when you need medicine. They watch over you every second to make sure the house is standing until you are strong again. So basically, that's the best analogy I can use to explain nursing to you and differentiate it from medicine, like from being a doctor. There are many other healthcare professionals. I mean, we have medical laboratory scientists, we have physiotherapists, we have a whole lot. They all do their work, right? I'm just giving an analogy because this confuses people a lot. And you know why it is that the nurse is always the one who is staying beside you in the hospital, like the one who stays, in the ward with you, because they have to keep you safe, make sure you recover, do everything in their power to ensure that whatever is wrong is fixed and that your body, you can attain holistic health again. And if you can, we ensure that you can live a very comfortable life with whatever condition you have, and we take care of you. I mean, we do everything you can you can't do for yourself when you're sick. I mean, from bathing you to dressing you to ensuring your environment is okay, to ensuring your bedspread is clean, to ensuring you don't get further infections. We do all that for you. So I hope with my explanation you know who a nurse is and you know what a nurse does.